Question 1. Benchmark analysis indicates that a patient presents with significant fatigue, nausea, and edema, reporting these symptoms for several weeks. The patient's primary care physician has ordered a comprehensive metabolic panel and a calculated glomerular filtration rate, GFR. Which of the following approaches best reflects the initial step in assessing if this patient meets the definition of end-stage renal disease (ESID) for regulatory and care planning purposes? Option A. Confirming the calculated GFR falls below the established threshold for ESID and SLASH, or the patient requires renal replacement therapy as per regulatory definitions. Option B. Documenting the patient's subjective complaints of fatigue, nausea, and edema as the primary indicators of ESID. Option C. Verifying the patient's current health insurance coverage and its limitations for dialysis treatment. Option D. Assessing the availability of specific dialysis modalities at local treatment centers before confirming ESID. Correct answer is A. Confirming the calculated GFR falls below the established threshold for ESID and SLASH, or the patient requires renal replacement therapy as per regulatory definitions. Explanation. The scenario presents a common challenge in dialysis nursing, ensuring accurate and timely identification of patients with end-stage renal disease, ESID, to facilitate appropriate care transitions and access to services. The professional challenge lies in the potential for delayed diagnosis or misclassification, which can lead to suboptimal patient outcomes, increased healthcare costs, and non-compliance with regulatory requirements for ESID care. Careful judgment is required to interpret diagnostic information and apply the established definition of ESID consistently. The correct approach represents best professional practice because it directly aligns with the regulatory framework governing ESID care. By adhering to the established definition of ESID, which typically involves a specific level of glomerular filtration rate, GFR, or the need for renal replacement therapy, RRT, nurses ensure that patients receive timely access to dialysis services and other necessary interventions. This adherence is crucial for meeting the requirements of programs like Medicare in the U.S., which define ESID for coverage purposes and mandate specific care coordination protocols. Ethical considerations also support this approach, as it prioritizes patient well-being by ensuring they are recognized and managed appropriately once they meet the criteria for ESID. An incorrect approach that relies solely on subjective patient complaints without objective diagnostic confirmation fails to meet regulatory standards. ESID is a clinical diagnosis based on objective measures, not just symptoms. Relying on symptoms alone could lead to delayed diagnosis and treatment, violating the ethical duty to provide timely care and potentially contravening regulations that require specific diagnostic criteria for ESID identification. Another incorrect approach that focuses on the patient's insurance status rather than their medical condition is ethically and regulatorily unsound. Patient care decisions must be based on medical necessity and established diagnostic criteria, not on financial considerations. This approach would violate principles of equitable care and could lead to discrimination, as well as non-compliance with regulations that mandate care based on medical need. A further incorrect approach that prioritizes the availability of specific dialysis modalities over the patient's actual ESID status is also problematic. While modality choice is important, the initial identification and management of ESID are paramount. Delaying recognition of ESID based on the availability of a preferred treatment option would compromise patient care and violate the fundamental requirement to address the patient's life-sustaining need for RRT. The professional reasoning process for similar situations should involve a systematic evaluation of patient data against established diagnostic criteria for ESID. This includes reviewing laboratory results, e.g., GFR, creatinine, clinical assessments, and physician orders. Nurses should be knowledgeable about the specific regulatory definitions of ESID applicable in their jurisdiction and advocate for patients who meet these criteria. Collaboration with nephrologists and other healthcare team members is essential to ensure accurate diagnosis and appropriate care planning. Continuous professional development regarding ESID definitions and care standards is also critical. Question 2. The evaluation methodology shows that when assessing the progression of chronic kidney disease in a patient undergoing dialysis, which of the following approaches provides the most comprehensive and clinically relevant understanding of the patient's current renal status and potential for further decline? Option A. focusing exclusively on the most recent serum creatinine value, assuming it directly reflects kidney function. Option B, reviewing the patient's initial CKD diagnosis date and assuming a consistent rate of decline. Option C, relying solely on the patient's self-reported fatigue levels and any reported changes in appetite. Option D, correlating estimated glomerular filtration rate, eGFR, with the presence and severity of edema and monitoring trends in serum albumin levels. The correct answer is D, correlating estimated glomerular filtration rate, eGFR, with the presence and severity of edema and monitoring trends in serum albumin levels. Explanation: the evaluation methodology shows that assessing the progression of chronic kidney disease, CKD, requires a nuanced understanding of various clinical indicators beyond just glomerular filtration rate, GFR. This scenario is professionally challenging because CKD progression is multifactorial, and relying on a single metric can lead to misinterpretation of a patient's true disease trajectory. Accurate assessment is crucial for timely intervention, patient education, and appropriate management strategies, all of which are governed by established nursing standards and regulatory guidelines for dialysis nursing. The correct approach represents best professional practice because it integrates multiple indicators of CKD progression, aligning with the comprehensive assessment principles outlined in the Certified in Dialysis Nursing (CDN) framework. This holistic view allows for a more accurate understanding of the patient's condition, enabling personalized care plans and proactive management. Regulatory compliance in dialysis nursing emphasizes patient safety and optimal outcomes, which are best achieved through thorough and multifaceted assessments. An incorrect approach that focuses solely on a single laboratory value, such as serum creatinine, fails to account for its limitations in reflecting true GFR, especially in individuals with varying muscle mass. This can lead to an underestimation or overestimation of kidney function, potentially delaying necessary interventions or leading to unnecessary anxiety. Ethically, this approach breaches the duty of care by providing an incomplete picture of the patient's health. Another incorrect approach that prioritizes patient-reported symptoms without correlating them with objective clinical data risks misdiagnosis or delayed diagnosis. While patient experience is vital, symptoms alone can be subjective and may not always directly correlate with the underlying pathological progression of CKD. This can lead to inappropriate treatment decisions and potentially compromise patient well-being, violating professional standards of evidence-based practice. A third incorrect approach that solely relies on the patient's historical diagnosis of CKD without ongoing monitoring of current clinical parameters is also professionally unacceptable. CKD is a progressive disease, and its trajectory can change over time. Failing to conduct regular, comprehensive assessments means missing critical changes in the disease state, which can have significant implications for patient management and outcomes. This constitutes a failure to adhere to the ongoing monitoring requirements mandated by professional nursing practice. Professional reasoning process for similar situations should involve a systematic approach. First, identify the core clinical question, assessing CKD progression. Second, recall and apply relevant CDN standards and regulatory guidelines for comprehensive patient assessment in CKD. Third, consider all available data, including laboratory values, GFR, creatinine, albuminuria, clinical signs and symptoms, patient history, and imaging studies. Fourth, synthesize this information to form a holistic understanding of the patient's condition. Finally, communicate findings and collaborate with the interdisciplinary team to develop and implement an evidence-based, patient-centered care plan. Question 3. Regulatory review indicates that certified in dialysis nursing, CDN, professionals are expected to actively manage patients with diabetes and hypertension as significant risk factors for kidney disease progression. Considering a new patient presenting with both conditions, which nursing approach best aligns with these expectations for comprehensive care and risk mitigation? Option A. Conduct a thorough assessment of the patient's current management of diabetes and hypertension, including medication adherence, lifestyle factors, and self-monitoring practices, and collaboratively develop individualized nursing interventions and patient education strategies to optimize control of these conditions. Option B. Document the patient's history of diabetes and hypertension in their chart and wait for specific physician orders related to these conditions before initiating any nursing interventions. Option C. Primarily focus on the immediate dialysis treatment plan, assuming the patient's primary care physician is adequately managing their diabetes and hypertension. Option D. Provide general educational materials on diabetes and hypertension to the patient without assessing their current understanding or specific management challenges. The correct answer is A. Conduct a thorough assessment of the patient's current management of diabetes and hypertension, including medication adherence, lifestyle factors, and self-monitoring practices, and collaboratively develop individualized nursing interventions and patient education strategies to optimize control of these conditions. Explanation. This scenario presents a common implementation challenge in dialysis nursing, ensuring that established risk factors for kidney disease, specifically diabetes and hypertension, are consistently and effectively addressed within patient care plans, aligning with regulatory expectations for chronic disease management. The challenge lies in translating knowledge of these risk factors into actionable, individualized nursing interventions that promote optimal patient outcomes and prevent disease progression, all while adhering to the specific standards of care for the Certified in Dialysis Nursing (CDN) credential. The correct approach involves a proactive and comprehensive assessment of the patient's current management of diabetes and hypertension, followed by the implementation of evidence-based nursing interventions tailored to their specific needs, and in collaboration with the interdisciplinary team. This includes educating the patient on the importance of medication adherence, lifestyle modifications, diet, exercise, and regular monitoring of blood glucose and blood pressure. It also entails advocating for appropriate medical management and timely referrals to specialists as needed, all documented within the patient's record. This approach represents best professional practice because it directly addresses the identified risk factors, aligns with the principles of chronic disease management, and upholds the nursing responsibility to provide safe, effective, and patient-centered care as expected by the CDN certification standards. An incorrect approach would be to solely rely on the physician's orders without independent nursing assessment and intervention regarding these known risk factors. This fails to leverage the nurse's unique role in patient education, monitoring, and advocacy, potentially leading to suboptimal management of diabetes and hypertension, and consequently, a higher risk of kidney disease complications. This approach represents a failure to meet the comprehensive scope of nursing practice expected for a CDN, which includes proactive risk identification and management. Another incorrect approach would be to focus only on the immediate dialysis treatment, without considering the broader impact of diabetes and hypertension on the patient's long-term kidney health. This narrow focus neglects the fundamental nursing responsibility to address modifiable risk factors that contribute to the underlying cause of kidney disease. Ethically and professionally, nurses are obligated to address the whole patient and their contributing health conditions, not just the symptoms or immediate treatment needs. A third incorrect approach would be to assume that the patient is adequately managing their diabetes and hypertension without specific inquiry or assessment. This passive stance can lead to missed opportunities for intervention and support, potentially allowing these critical risk factors to worsen. It demonstrates a lack of proactive engagement and fails to meet the standard of care that requires nurses to actively assess and address known risk factors for disease progression. The professional reasoning process for similar situations should involve a systematic approach. First, identify the patient's known risk factors for kidney disease, diabetes, hypertension. Second, assess the current status of these risk factors and the patient's understanding and management strategies. Third, collaborate with the patient and the interdisciplinary team to develop and implement individualized care plans that address these risk factors. Fourth, monitor the effectiveness of interventions and adjust as necessary. Finally, document all assessments, interventions, and outcomes thoroughly, ensuring compliance with all relevant regulatory guidelines and professional standards. Question 4. System analysis indicates a patient newly diagnosed with end-stage renal disease (ESID) expresses significant apprehension and reluctance regarding the initiation of hemodialysis, citing fears about quality of life and the perceived burden of treatment. The nephrologist has recommended dialysis as medically necessary. As the dialysis nurse, what is the most appropriate initial course of action? Option A. Inform the patient that dialysis is medically necessary and that their refusal to start treatment could have severe health consequences, implying that their concerns are secondary to their immediate medical needs. Option B. Engage in a detailed, empathetic conversation with the patient to explore their specific fears and concerns about dialysis. Provide clear and understandable information about the treatment, its benefits, risks, and alternatives, and collaboratively discuss strategies to address their quality of life worries. Option C. Document the patient's reluctance and inform the nephrologist to proceed with the medical recommendation, assuming the physician will handle the patient's decision-making process. Option D. Proceed with scheduling the dialysis initiation as planned, assuring the patient that they will get used to it once treatment begins and that their concerns will be addressed as they arise. The correct answer is B. Engage in a detailed, empathetic conversation with the patient to explore their specific fears and concerns about dialysis. Provide clear and understandable information about the treatment, its benefits, risks, and alternatives, and collaboratively discuss strategies to address their quality of life worries. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the perceived best interests of the patient as determined by the healthcare team. The core ethical dilemma lies in respecting patient autonomy versus the principle of beneficence. In the context of dialysis nursing, patient autonomy is paramount, as it involves long-term treatment decisions with significant lifestyle implications. The correct approach, which involves open communication, thorough education, and exploring the patient's underlying concerns, represents best professional practice. This aligns with the ethical principles of autonomy and informed consent, which are foundational in healthcare. Specifically, it upholds the patient's right to make decisions about their own body and treatment, even if those decisions differ from what the healthcare team might recommend. This approach also adheres to regulatory frameworks that mandate patient-centered care and the provision of adequate information for decision-making. An incorrect approach would be to dismiss the patient's concerns or to proceed with treatment initiation without fully addressing their apprehension. This would represent a failure to uphold patient autonomy and could lead to a breach of informed consent. Ethically, it violates the principle of respect for persons. From a regulatory standpoint, it could be seen as a failure to provide adequate patient education and support, potentially leading to non-adherence and negative health outcomes, which could have legal ramifications. Another incorrect approach would be to pressure the patient into accepting dialysis without fully understanding their reasons for hesitation. This coercive tactic undermines patient autonomy and can damage the therapeutic relationship, violating ethical guidelines that emphasize trust and collaboration. Professionals should approach such situations by first actively listening to the patient to understand the root of their reluctance. This involves empathetic inquiry into their fears, concerns, and values. Following this, providing comprehensive, jargon-free education about dialysis, its benefits, risks, and alternatives, tailored to the patient's understanding, is crucial. Exploring potential barriers to adherence, such as social support, financial concerns, or psychological distress, and offering resources to address these is also vital. The decision-making process should be a collaborative one, empowering the patient to make an informed choice that aligns with their personal goals and values, while ensuring they understand the consequences of their decisions. Question 5. Cost-benefit analysis shows that implementing a more frequent monitoring schedule for patients experiencing significant interdialytic weight gain and edema would be beneficial. A certified dialysis nurse is caring for a patient who presents with increased shortness of breath and crackles in the lungs, indicative of fluid overload. The nurse understands that the kidney's inability to effectively excrete excess fluid and sodium is the primary physiological cause. Considering the patient's presentation and the underlying renal physiology, which of the following actions best reflects appropriate nursing judgment in this situation? Option A. Initiate a fluid challenge with intravenous normal saline to improve cardiac output and alleviate shortness of breath. Option B. Encourage the patient to ambulate to promote circulation and reduce fluid accumulation in the lungs. Option C. Notify the physician immediately to discuss the patient's signs of fluid overload and potential adjustments to the dialysis prescription, such as initiating ultrafiltration earlier or increasing the rate. Option D. Administer a diuretic as prescribed to promote rapid fluid excretion and reduce pulmonary congestion. Correct answer is A. Initiate a fluid challenge with intravenous normal saline to improve cardiac output and alleviate shortness of breath. Explanation: this scenario is professionally challenging because it requires the dialysis nurse to integrate a patient's complex physiological response with established nursing protocols and the underlying principles of renal anatomy and physiology. The nurse must make a rapid, informed decision that prioritizes patient safety and optimal treatment outcomes while adhering to the specific regulatory framework governing dialysis nursing. The correct approach represents best professional practice because it directly addresses the physiological manifestation of impaired renal function by considering the impact on fluid and electrolyte balance, which are critical in dialysis. This approach aligns with the fundamental understanding of the nephron's role in regulating these balances and the potential consequences of their disruption. Adherence to established protocols, informed by this physiological understanding, ensures that interventions are evidence-based and patient-centered, thereby upholding the ethical obligation to provide competent care and meeting the standards of practice expected of a certified dialysis nurse. An incorrect approach that focuses solely on a superficial symptom without considering the underlying physiological derangement fails to address the root cause of the patient's distress. This could lead to delayed or inappropriate interventions, potentially exacerbating the patient's condition and violating the ethical principle of non-maleficence. Another incorrect approach that deviates from established protocols without a clear, documented rationale based on a comprehensive assessment of the patient's renal status and overall condition represents a failure to adhere to professional standards and regulatory guidelines. Such deviation could be construed as practicing outside the scope of established best practices and could have serious legal and ethical ramifications. A third incorrect approach that prioritizes administrative convenience over immediate patient needs demonstrates a significant ethical failure, prioritizing non-clinical factors over the patient's well-being and potentially violating the principle of patient advocacy. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's current physiological state, linking observed signs and symptoms to the underlying renal anatomy and physiology. This assessment should then be used to evaluate the patient's status against established clinical protocols and guidelines. The nurse must then consider the potential benefits and risks of various interventions, always prioritizing patient safety and optimal outcomes. This systematic approach ensures that decisions are not only clinically sound, but also ethically defensible and compliant with regulatory requirements. Question 6. Implementation of best practices for a patient presenting with sudden onset of oliguria, elevated serum creatinine, and decreased urine output requires a systematic approach. Which of the following sequences of actions best reflects the immediate management priorities for suspected acute kidney injury, EKI? Option A. Immediately administer a loop diuretic to promote urine output, followed by obtaining laboratory tests and consulting nephrology. Option B. Focus on managing the patient's nausea and vomiting, and wait for the nephrology team to arrive before initiating any interventions. Option C. Administer intravenous fluids to address potential hypovolemia, obtain baseline laboratory tests including serum creatinine, BUN, and electrolytes, and notify the nephrology team for consultation. Option D. Administer intravenous fluids, and then wait for laboratory results to confirm AKI before notifying the nephrology team. The correct answer is C. Administer intravenous fluids to address potential hypovolemia, obtain baseline laboratory tests including serum creatinine, BUN, and electrolytes, and notify the nephrology team for consultation. Explanation: scenario analysis. This scenario is professionally challenging because it requires the dialysis nurse to rapidly assess and manage a patient experiencing a sudden decline in renal function, potentially leading to life-threatening complications. Differentiating between various causes of acute kidney injury, AKI, and implementing appropriate interventions in a timely manner is critical. The nurse must balance immediate patient needs with adherence to established protocols and physician orders, all while ensuring patient safety and comfort. The dynamic nature of AKI necessitates continuous monitoring and adaptation of care. Correct approach analysis. The correct approach prioritizes immediate stabilization and diagnostic workup. This aligns with best professional practice by addressing the most critical aspects of AKI management first. Promptly initiating intravenous fluid resuscitation addresses potential hypovolemia, a common reversible cause of AKI. Simultaneously, obtaining essential laboratory data, serum creatinine, BUN, electrolytes, Urinalysis is crucial for diagnosis and staging of AKI, guiding further treatment decisions. Alerting the nephrology team ensures timely specialist consultation and management, which is a cornerstone of effective AKI care. This comprehensive, multifaceted approach directly addresses the immediate threats posed by AKI and facilitates accurate diagnosis and tailored treatment, adhering to established clinical guidelines for AKI management. Incorrect approach is analysis. Delaying fluid resuscitation while awaiting laboratory results is professionally unacceptable because it can exacerbate hypoperfusion and worsen renal damage, particularly if hypovolemia is the primary cause of AKI. This failure to act promptly on a potentially reversible cause constitutes a deviation from best practice and could lead to poorer patient outcomes. Administering diuretics without assessing fluid status or identifying the underlying cause of AKI is also professionally unsound. Diuretics can be detrimental in hypovolemic AKI, further dehydrating the patient and worsening renal function. This approach demonstrates a lack of critical assessment and a premature, potentially harmful, intervention. Focusing solely on symptom management without addressing the underlying cause or initiating diagnostic measures is insufficient. While symptom relief is important, it does not constitute comprehensive AKI management and fails to address the root of the problem, potentially allowing the AKI to progress. Professional reasoning. Professionals should approach AKI management by first performing a rapid assessment of the patient's hemodynamic status and identifying potential reversible causes. This involves a systematic evaluation of fluid balance, vital signs, and presenting symptoms. The next step is to initiate appropriate interventions to stabilize the patient, such as fluid administration if hypovolemia is suspected. Concurrently, obtaining essential diagnostic data is paramount to confirm the diagnosis, determine the stage of AKI, and identify the underlying etiology. Collaboration with the nephrology team is essential for complex cases or when initial management is insufficient. This decision-making process emphasizes a proactive, evidence-based, and collaborative approach to patient care, prioritizing patient safety and optimal outcomes. Question 7. Stakeholder feedback indicates a potential issue with the dialysis water treatment system, specifically concerning the output from the reverse osmosis (RO) and deionization (DI) units. As the responsible dialysis nurse, what is the most appropriate immediate action to ensure patient safety and regulatory compliance? Option A. Dismiss the feedback as likely due to user error or misperception, as the system has performed adequately in the past. Option B. Rely on historical water quality logs to confirm system performance without performing current tests, assuming no significant changes have occurred. Option C. Conduct immediate, objective testing of the RO and DI unit output water to verify the reported concern and document all findings. Option D. Immediately shut down the entire water treatment system to prevent any potential contamination, regardless of the specific nature of the feedback. The correct answer is C. Conduct immediate, objective testing of the RO and DI unit output water to verify the reported concern and document all findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dialysis nurse to balance immediate patient needs with long-term system integrity and regulatory compliance. A perceived minor deviation in water quality, especially when reported by a stakeholder, necessitates a prompt and thorough investigation to prevent potential patient harm and ensure adherence to established protocols. The challenge lies in accurately assessing the significance of the feedback and implementing the appropriate corrective actions without causing undue disruption to patient care. Correct approach analysis. The correct approach involves a systematic, evidence-based response that prioritizes patient safety and regulatory adherence. This includes immediately verifying the reported issue through objective testing of the water treatment system's output, specifically focusing on the reverse osmosis (RO) and deionization (DI) stages. Documenting all findings and initiating corrective actions as per facility policy and regulatory guidelines, e.g., those outlined by the Centers for Medicare and Medicaid Services, CMS, in the U.S., which govern dialysis facilities, is paramount. This approach ensures that any potential compromise to water purity is identified and rectified promptly, safeguarding patients from dialysis-related infections or other adverse events linked to substandard water quality. It aligns with the ethical obligation to provide safe and effective care and the regulatory requirement for maintaining water quality standards. Incorrect approach is analysis. One incorrect approach involves dismissing the stakeholder feedback without objective verification. This is a significant ethical and regulatory failure. Ethically, it demonstrates a disregard for patient or staff concerns, potentially leading to a breakdown in trust and communication. Regulationally, it violates the principle of proactive quality assurance and risk management. Facilities are required to have systems in place to monitor and address potential issues with water quality, and ignoring feedback bypasses this critical safeguard. Another incorrect approach is to immediately shut down the entire water system without a proper assessment. While caution is important, an overreaction can lead to significant disruption of patient care, potentially causing delays in dialysis treatments. This approach lacks a reasoned, evidence-based decision-making process. Regulationally, while immediate action might be warranted in severe cases, a disproportionate response without investigation can be inefficient and may not align with established emergency protocols, which typically involve a tiered response based on the severity of the issue. A third incorrect approach is to rely solely on anecdotal evidence or past performance without current testing. Water quality can fluctuate due to various factors, including membrane integrity, filter lifespan, and source water changes. Relying on assumptions rather than current data is a failure in due diligence and can lead to undetected contamination. This is a regulatory failure, as it does not meet the standard of ongoing monitoring and validation required for dialysis water treatment systems. Professional reasoning. Professionals should employ a structured problem-solving approach. First, acknowledge and document all stakeholder feedback. Second, initiate immediate objective testing of the relevant system components, RO and die units, to validate the concern. Third, consult facility policies and relevant regulatory guidelines, e.g., CMS standards for dialysis water quality, to determine the appropriate course of action based on test results. Fourth, implement corrective actions, which may range from recalibration to component replacement and retest to confirm resolution. Finally, document all steps taken, findings, and resolutions to ensure accountability and continuous quality improvement. This systematic process ensures patient safety, regulatory compliance, and effective resource management. Question 8. The audit findings indicate a need to reinforce best practices in comprehensive patient assessment for dialysis patients. Which of the following nursing actions, when performing a pre-dialysis history and physical examination, best aligns with the Certified in Dialysis Nursing, CDN, regulatory framework and ensures optimal patient safety and care? Option A. Focusing primarily on the patient's vital signs and fluid status, assuming that other aspects of their health are stable unless explicitly reported by the patient. Option B. Prioritizing the assessment of the vascular access site for patency and signs of infection, while also inquiring about the patient's subjective well-being, recent dietary changes, and any new or worsening symptoms since the last treatment. Option C. Conducting a brief review of the patient's electronic health record for recent lab results and administering the prescribed dialysis treatment promptly to maximize treatment time. Option D. Delegating the initial patient interview and basic physical assessment components to a licensed practical nurse, while the registered nurse reviews the findings and initiates treatment. The correct answer is B. Prioritizing the assessment of the vascular access site for patency and signs of infection, while also inquiring about the patient's subjective well-being, recent dietary changes, and any new or worsening symptoms since the last treatment. Explanation. The audit findings highlight a critical area of patient care, the comprehensive assessment of patients undergoing dialysis. This scenario is professionally challenging because it directly impacts patient safety, treatment efficacy, and adherence to regulatory standards. A thorough history and physical examination are foundational to identifying potential complications, tailoring treatment plans, and ensuring the patient's well-being. The requirement for absolute priority in adhering to the Certified in Dialysis Nursing, CDN, regulatory framework means that all actions must align with established guidelines and legal mandates for dialysis nursing practice within the specified jurisdiction. The correct approach represents best professional practice because it demonstrates a commitment to evidence-based nursing care and patient advocacy, as mandated by the CDN framework. A systematic and thorough assessment, encompassing both subjective patient reports and objective physical findings, allows the nurse to identify subtle changes that could indicate developing problems, such as fluid overload, electrolyte imbalances, or access complications. This proactive approach is essential for preventing adverse events and ensuring optimal patient outcomes, directly aligning with the CDN's emphasis on quality patient care and safety. Furthermore, meticulous documentation of this assessment serves as a legal record and a communication tool, vital for interdisciplinary collaboration and regulatory compliance. Incorrect approaches represent specific regulatory or ethical failures. Failing to elicit a detailed patient history, including past medical conditions, current medications, and subjective complaints, violates the CDN's expectation of a holistic patient assessment. This omission can lead to misdiagnoses or inadequate treatment adjustments, potentially compromising patient safety and contravening the ethical duty of care. Similarly, neglecting key components of the physical examination, such as assessing the vascular access site for signs of infection or malfunction, evaluating for edema, or checking vital signs with appropriate attention to trends, directly contravenes the CDN standards for competent nursing practice. Such oversights can result in delayed interventions for critical issues, leading to patient harm and potential regulatory sanctions for the facility and the nurse. The professional reasoning process for similar situations should involve a systematic approach to patient assessment, guided by established nursing protocols and regulatory requirements. This includes prioritizing patient safety, actively listening to patient concerns, performing a comprehensive head-to-toe physical examination, and meticulously documenting all findings. When faced with ambiguous findings or potential complications, nurses should consult with their interdisciplinary team, refer to established clinical guidelines, and escalate concerns as necessary, always prioritizing the patient's best interest and adhering to the CDN's strict regulatory framework. Question 9. The efficiency study reveals that a patient undergoing hemodialysis, who is typically normotensive, is now presenting with a significant increase in blood pressure and signs of fluid overload, including peripheral edema and shortness of breath. Laboratory results indicate a slight elevation in serum potassium, considering the role of the renin-angiotensin-aldosterone system, RAS, in fluid and electrolyte balance and blood pressure regulation. Which of the following nursing actions is the most appropriate initial step to address this patient's presentation? Option A. Advise the patient to restrict fluid intake significantly until the next dialysis session to manage the fluid overload. Option B. Administer a PRN dose of an antihypertensive medication as ordered by the physician to quickly lower the patient's blood pressure. Option C. Assess the patient's current fluid status, review the dialysis prescription for any recent changes, and evaluate recent intake and output records to determine if fluid overload is the primary driver of the hypertension. Option D. Document the elevated blood pressure and edema and wait for the nephrologist to address these findings during the next scheduled clinic visit. The correct answer is C. Assess the patient's current fluid status, review the dialysis prescription for any recent changes, and evaluate recent intake and output records to determine if fluid overload is the primary driver of the hypertension. Explanation: this scenario is professionally challenging because it requires the dialysis nurse to interpret complex physiological data in the context of a patient's overall clinical presentation and the specific regulatory requirements for dialysis care. The renin-angiotensin-aldosterone system, RAS, plays a crucial role in fluid and electrolyte balance, blood pressure regulation, and kidney function, all of which are directly impacted by dialysis. A nurse must understand how RAS is affected by dialysis interventions and how to respond to abnormal findings within the established regulatory framework for certified dialysis nursing, CDN, practice. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established clinical protocols and regulatory guidelines. By recognizing the potential for RAS dysregulation in a patient experiencing symptoms suggestive of volume overload and hypertension, and by initiating a systematic assessment that includes reviewing the patient's current dialysis prescription and laboratory values, the nurse is acting within the scope of practice and demonstrating critical thinking. This approach aligns with the CDN's responsibility to monitor patient response to treatment, identify potential complications, and collaborate with the nephrologist to adjust care as needed, all while adhering to the principles of evidence-based practice and patient advocacy. An incorrect approach that focuses solely on administering PRN antihypertensives without a thorough assessment of the underlying cause of hypertension would be a regulatory and ethical failure. This bypasses the critical step of identifying whether the hypertension is a direct consequence of RAS activation due to fluid overload or another factor, which is directly related to the dialysis prescription and the patient's fluid status. Such an action could mask a more serious issue, lead to inappropriate medication use, and potentially harm the patient by causing hypotension or other adverse effects. It also fails to uphold the professional responsibility to investigate the root cause of clinical changes. Another incorrect approach, such as delaying notification of the nephrologist until the next scheduled appointment, represents a failure to provide timely and appropriate care. The CDN is expected to recognize acute changes in a patient's condition that may indicate a need for immediate medical intervention. RAS-related complications, especially those leading to significant hypertension and potential organ damage, require prompt evaluation and management by the physician. This delay could exacerbate the patient's condition and lead to adverse outcomes, violating the ethical duty of care and potentially contravening regulatory expectations for vigilant patient monitoring. A professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and assess the patient's signs and symptoms, correlating them with potential physiological derangements, particularly those related to RAS. 2. Review the patient's current dialysis prescription, recent fluid balance, and laboratory results to identify contributing factors. 3. Consult relevant clinical guidelines and institutional protocols for managing hypertension and fluid overload in dialysis patients. 4. Communicate findings and concerns promptly and clearly to the nephrologist, providing a comprehensive overview of the patient's status and proposed interventions. 5. Implement physician-ordered adjustments to the dialysis prescription or medications, and continue to monitor the patient's response. Question 10. Investigation of the impact of a patient's current dialysis modality on their clinical presentation and the subsequent nursing assessment priorities. Option A. Prioritize assessment of signs and symptoms directly related to the patient's specific dialysis modality, hemodialysis or peritoneal dialysis. Option B. Assume all dialysis patients require the same immediate interventions for common symptoms. Option C. Focus assessment on general signs of fluid overload, irrespective of the dialysis type. Option D. Evaluate symptoms that are common to all chronic illnesses without specific consideration for dialysis. The correct answer is A. Prioritize assessment of signs and symptoms directly related to the patient's specific dialysis modality, hemodialysis or peritoneal dialysis. Explanation. This scenario presents a common challenge in dialysis nursing, adapting care to individual patient needs and understanding the distinct implications of different dialysis modalities. The professional challenge lies in accurately assessing the patient's current clinical status and understanding how their chosen dialysis modality impacts their overall health and potential complications. This requires a deep understanding of both hemodialysis and peritoneal dialysis, not just their technical aspects, but their physiological effects and patient-specific considerations. Careful judgment is required to differentiate between the nuances of each modality and their respective impacts on patient well-being and treatment effectiveness. The correct approach represents best professional practice because it directly addresses the core of the patient's current treatment and its implications. By focusing on the patient's specific dialysis modality, the nurse demonstrates an understanding of the unique physiological stresses, potential complications, and management strategies associated with that modality. This aligns with the principles of patient-centered care and evidence-based practice, ensuring that the assessment and subsequent interventions are tailored to the patient's specific treatment regimen. This approach is implicitly supported by nursing practice standards that emphasize comprehensive patient assessment and understanding of treatment modalities. An incorrect approach that focuses solely on general signs of fluid overload without considering the dialysis modality fails to recognize that fluid management strategies and the body's response to fluid shifts differ significantly between hemodialysis and peritoneal dialysis. For example, a patient on peritoneal dialysis might exhibit different signs of fluid overload compared to a hemodialysis patient due to the continuous nature of fluid exchange and the presence of the dialysate in the peritoneal cavity. This oversight could lead to misdiagnosis or delayed appropriate treatment. Another incorrect approach that prioritizes symptoms unrelated to the dialysis modality ignores the direct impact of the treatment on the patient's current clinical presentation. For instance, focusing on a patient's appetite without considering their dialysis type might miss crucial signs of electrolyte imbalance or fluid shifts that are directly attributable to their dialysis treatment. This demonstrates a lack of understanding of the interconnectedness of dialysis and overall patient health. A further incorrect approach that assumes all dialysis patients require the same immediate interventions, regardless of modality, is a critical failure. It disregards the fundamental differences in how hemodialysis and peritoneal dialysis function and the distinct risks and benefits associated with each. This could lead to inappropriate or even harmful interventions, as a treatment suitable for one modality might be contraindicated or ineffective for another. The professional decision-making process for similar situations should begin with a thorough assessment of the patient's current dialysis modality. This understanding then informs the subsequent assessment of clinical signs and symptoms, allowing the nurse to interpret findings within the context of that specific modality. The nurse should consider the physiological principles underlying each type of dialysis, potential complications specific to each, and the patient's individual response to treatment. This contextualized approach ensures that nursing care is both accurate and effective, adhering to the highest standards of patient safety and quality of care. Question 11. What factors determine the specific dialysis prescription and nursing interventions required for a patient with chronic kidney disease, considering the structural and functional integrity of their nephrons? Option A. The degree of damage to the glomeruli and tubules, impacting filtration and reabsorption capacity. Option B. The patient's reported level of fatigue and appetite. Option C. The availability of different dialysis machine models. Option D. The nurse's personal preference for specific dialysis techniques. Correct answer is A. The degree of damage to the glomeruli and tubules, impacting filtration and reabsorption capacity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dialysis nurse to integrate knowledge of kidney structure and function with the specific regulatory framework governing dialysis care in the United States, as defined by the Centers for Medicare and Medicaid Services, CMS, and relevant professional nursing standards. The nurse must accurately assess a patient's physiological status and understand how underlying structural and functional impairments of the kidneys necessitate specific nursing interventions, all while adhering to established protocols and patient safety guidelines. Misinterpreting these factors can lead to suboptimal patient outcome, regulatory noncompliance, and potential harm. Correct approach analysis. The correct approach emphasizes the nurse's responsibility to understand the physiological basis of the patient's condition and how it impacts dialysis treatment. This aligns with the core principles of nursing practice, which mandate a thorough assessment and understanding of the patient's pathophysiology to provide safe and effective care. Specifically, understanding the nephron's role in filtration, reabsorption, and secretion is crucial for interpreting laboratory values, managing fluid and electrolyte balance, and anticipating complications. This knowledge directly informs the selection and adjustment of dialysis parameters, ensuring the treatment effectively addresses the patient's specific kidney dysfunction. Regulatory frameworks, such as those outlined by CMS for end-stage renal disease (ESID) facility, implicitly require nurses to possess and apply this fundamental knowledge to deliver appropriate care. Professional standards of practice for dialysis nurses also underscore the importance of this physiological understanding. Incorrect approaches analysis. One incorrect approach focuses solely on the immediate symptoms without delving into the underlying structural and functional deficits of the kidney. This is a superficial assessment that fails to address the root cause of the patient's condition and can lead to a reactive rather than proactive care plan. It neglects the fundamental understanding of kidney physiology required by dialysis nurses and could result in overlooking critical indicators of worsening kidney function or complications. Another incorrect approach prioritizes patient comfort over physiological management. While patient comfort is a vital aspect of care, it cannot supersede the essential physiological interventions required to manage kidney failure. Dialysis is a life-sustaining treatment, and its efficacy is directly tied to addressing the kidney's impaired ability to perform their functions. Focusing solely on comfort without addressing the underlying physiological needs would be a failure to provide necessary medical treatment and would violate regulatory expectations for comprehensive patient care. A third incorrect approach relies exclusively on physician orders without independent nursing assessment and critical thinking. While nurses must follow physician orders, their role also involves independent assessment, monitoring, and the application of their specialized knowledge. A dialysis nurse is expected to understand the rationale behind orders and to identify when adjustments might be necessary based on the patient's ongoing physiological response. Over-reliance on orders without understanding the underlying kidney structure and function can lead to missed opportunities for intervention or the continuation of inappropriate treatment. This approach fails to meet the professional standards of a dialysis nurse and could lead to regulatory issues if patient care is compromised due to a lack of independent nursing judgment. Professional reasoning. Dialysis nurses must employ a systematic decision-making process that begins with a comprehensive understanding of kidney structure and function. This foundational knowledge allows for accurate patient assessment, including the interpretation of clinical signs, symptoms, and laboratory data. The nurse then integrates this physiological understanding with physician orders and established clinical protocols. Critical thinking is essential to evaluate the patient's response to treatment, anticipate potential complications, and advocate for necessary adjustments. Adherence to regulatory requirements, such as those set by CMS, and professional ethical standards ensures that care is safe, effective, and patient-centered. This process involves continuous learning and the application of evidence-based practice to optimize outcomes for patients with kidney disease. Question 12. When evaluating a patient with chronic kidney disease for potential initiation of hemodialysis, which of the following clinical presentations most strongly indicates an urgent need for renal replacement therapy according to U.S. regulatory frameworks and established nephrology practice guidelines? Option A. Persistent nausea and vomiting, significant fatigue, and a serum creatinine level of 4.5 mg/dl with a stable glomerular filtration rate (GFR) over the past month. Option B. A calculated GFR of 15 ml/min/1, 73 m2 with a serum creatinine level of 5.0 mg/dl, but the patient denies any symptoms. Option C. A serum creatinine level of 3.0 mg/dl with no reported symptoms and a GFR that has been gradually declining over 6 months. Option D. Generalized edema, shortness of breath, and a serum potassium level of 6.8 mx/L despite a serum creatinine level of 4.0 mg/dl. The correct answer is A. Persistent nausea and vomiting, significant fatigue, and a serum creatinine level of 4.5 mg/dl with a stable glomerular filtration rate, GFR, over the past month. Explanation. This scenario is professionally challenging because it requires the dialysis nurse to synthesize multiple clinical indicators and apply established regulatory guidelines to determine the necessity of initiating dialysis. The challenge lies in recognizing that indications for dialysis are not solely based on a single laboratory value, but rather a constellation of clinical signs and symptoms that signify a failure of the kidneys to adequately perform their excretory and regulatory functions. The CDN must possess a thorough understanding of the U.S. regulatory framework governing dialysis, including guidelines from organizations such as the Centers for Medicare and Medicaid Services, CMS, and professional bodies like the American Nephrology Nurses Association, ANNA, which inform best practices for patient care and treatment initiation. The correct approach represents best professional practice because it aligns with the comprehensive assessment mandated by U.S. regulations for initiating renal replacement therapy. This approach prioritizes patient safety and well-being by considering both objective laboratory data and subjective clinical manifestations of uremia. It reflects the ethical obligation to provide timely and appropriate care when a patient's health is significantly compromised by renal dysfunction. Adherence to these established guidelines ensures that dialysis is initiated when medically indicated, preventing further deterioration and potential complications. An incorrect approach that focuses solely on a single laboratory value, such as serum creatinine, without considering the patient's overall clinical status, represents a significant regulatory and ethical failure. U.S. regulations emphasize a holistic patient assessment. Relying on a single parameter can lead to either premature initiation of dialysis, exposing the patient to unnecessary risks and resource utilization, or delayed initiation, allowing for the progression of severe uremic symptoms and complications. Another incorrect approach that ignores overt signs of fluid overload or electrolyte imbalance, even with moderately elevated creatinine, fails to address immediate life-threatening conditions, violating the ethical duty to act in the patient's best interest and potentially contravening CMS guidelines on emergency care. The professional decision-making process for similar situations involves a systematic approach. First, thoroughly review the patient's current laboratory values, paying attention to trends and not just single points. Second, conduct a comprehensive physical assessment to identify signs and symptoms of uremia, fluid overload, and electrolyte disturbances. Third, consult with the nephrology team to discuss the findings and collaboratively determine the most appropriate course of action based on established clinical guidelines and regulatory requirements. Finally, document the assessment, rationale for the decision, and the plan of care meticulously. Question 13. Governance review demonstrates that a patient undergoing hemodialysis presents with a significant decrease in serum bicarbonate and a corresponding drop in arterial pH, indicative of metabolic acidosis. The patient is hemodynamically stable but exhibiting mild confusion. Which of the following nursing actions best reflects adherence to established dialysis protocols and ethical patient care in managing this acid-base imbalance? Option A. Monitor the patient closely and recheck electrolytes in 4 hours. Option B. Increase the dialysate bicarbonate concentration for the current treatment session. Option C. Administer a bolus of intravenous normal saline to improve hydration. Option D. Administer a bolus of intravenous sodium bicarbonate as per physician order. The correct answer is D. Administer a bolus of intravenous sodium bicarbonate as per physician order. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dialysis nurse to interpret complex physiological data, acid-base balance, in the context of a patient's acute condition, and to make an immediate evidence-based decision regarding treatment adjustment. The challenge lies in the potential for rapid deterioration if the acid-base imbalance is not addressed promptly and accurately, impacting patient safety and outcomes. The nurse must integrate knowledge of renal physiology, dialysis principles, and the specific patient's clinical presentation. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the underlying physiological derangement identified through assessment and laboratory data. By recognizing the metabolic acidosis and its potential impact on the patient's overall stability, the nurse prioritizes a therapeutic intervention that aligns with established dialysis protocols and best practices for managing acid-base disturbances in end-stage renal disease. This approach is ethically sound, prioritizing patient well-being and adhering to the standard of care expected of a certified dialysis nurse. It demonstrates a proactive and informed response to a critical clinical finding, aiming to restore homeostasis. Incorrect approach is analysis, an approach that focuses solely on increasing the dialysate bicarbonate concentration without considering the patient's current hemodynamic status or other electrolyte imbalances would be a regulatory and ethical failure. This is because it represents a potentially harmful oversimplification of a complex problem, ignoring other contributing factors and the risk of rapid fluid shifts or electrolyte disturbances. It fails to adhere to the principle of individualized patient care and may violate guidelines that mandate a comprehensive assessment before initiating or altering treatment. Another incorrect approach would be to delay intervention while awaiting further, non-urgent laboratory results that do not directly address the immediate acid-base concern. This delay constitutes a failure to act in a timely manner when a critical physiological imbalance is identified, potentially leading to patient harm. It violates the ethical obligation to provide prompt and appropriate care and may contraindicate established protocols for managing acute metabolic acidosis in dialysis patients. Finally, an approach that involves consulting with a physician but not initiating any immediate, appropriate nursing interventions based on the clear evidence of metabolic acidosis would also be professionally unacceptable. While physician consultation is crucial, the nurse has a professional responsibility to act within their scope of practice to stabilize the patient. Delaying all action until physician orders are received, when the clinical picture and data strongly suggest a specific intervention, could be considered a failure to provide timely and effective care, potentially contravening professional standards and patient safety guidelines. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment, integrating all available data, vital signs, laboratory results, patient symptoms. They should then identify the primary physiological problem and its potential consequences. Based on this analysis, they should consult relevant clinical guidelines and protocols to determine the most appropriate and evidence-based intervention. If the situation is emergent or outside the nurse's independent scope of practice, prompt and clear communication with the physician is essential, while also considering any immediate, safe nursing actions that can be taken to stabilize the patient. This systematic approach ensures patient safety, adherence to regulatory requirements, and ethical practice. Question 14. Compliance review shows a dialysis patient expresses a desire to feel better quickly and asks if they can have more fluids during their treatment, stating they feel weak. The nurse is aware that the patient's current fluid status is within the prescribed dry weight range, and their laboratory values indicate the need for waste product removal. Considering the definition and purpose of dialysis, which of the following actions best addresses the patient's request while adhering to best professional practice and regulatory guidelines? Option A. Administer an additional liter of intravenous fluid to help the patient feel stronger, as their subjective feeling of weakness is a primary concern. Option B. Focus on administering medications to alleviate the feeling of weakness without discussing the purpose of dialysis or fluid management. Option C. Explain to the patient that dialysis is designed to remove waste products and excess fluid to improve their overall health, and that while weakness can be a side effect, increasing fluid intake during treatment would counteract the primary goal of fluid removal and could be detrimental. Option D. Inform the patient that their request cannot be fulfilled and proceed with the standard dialysis treatment without further explanation. The correct answer is C. Explain to the patient that dialysis is designed to remove waste products and excess fluid to improve their overall health, and that while weakness can be a side effect, increasing fluid intake during treatment would counteract the primary goal of fluid removal and could be detrimental. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the immediate needs of a patient with the fundamental principles of dialysis therapy and the regulatory requirements governing its practice. The patient's expressed desire to feel better quickly could lead to interventions that deviate from the established purpose of dialysis, potentially compromising long-term outcomes and patient safety. The nurse must possess a deep understanding of dialysis's definition and purpose to navigate this situation effectively. Correct approach analysis. The correct approach emphasizes educating the patient about the definition and purpose of dialysis. This aligns with best professional practice by prioritizing patient autonomy through informed consent and shared decision-making. Dialysis, as defined by its purpose, is a life-sustaining treatment to remove waste products and excess fluid from the blood when the kidneys can no longer perform these functions adequately. By explaining this, the nurse empowers the patient to understand the rationale behind the treatment, manage expectations, and participate actively in their care plan. This approach upholds the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring treatment is administered appropriately and understood by the patient. Regulatory frameworks for dialysis nursing, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, in the U.S., mandate patient education and adherence to established treatment protocols to ensure quality care and patient safety. Incorrect approaches analysis. One incorrect approach focuses solely on symptom relief without addressing the underlying purpose of dialysis. This fails to meet the core definition of dialysis, which is to restore a level of homeostasis by removing toxins and fluid. Prioritizing immediate symptom relief over the fundamental purpose of the treatment could lead to inadequate waste removal or fluid management, potentially causing harm and violating the principle of beneficence. It also neglects the regulatory requirement for comprehensive patient education regarding their treatment. Another incorrect approach involves administering additional fluids to make the patient feel better. This directly contradicts the primary purpose of dialysis, which is often to remove excess fluid. Administering more fluid would exacerbate fluid overload, leading to adverse effects such as shortness of breath, hypertension, and cardiac strain. This approach is not only therapeutically unsound, but also a direct violation of the principles of safe and effective dialysis practice, potentially leading to patient harm and regulatory noncompliance. A further incorrect approach is to dismiss the patient's request without explanation. This disregards the patient's subjective experience and their right to understand their treatment. Effective patient care requires empathy and clear communication. Failing to explain the purpose of dialysis and how it addresses their condition can erode trust and lead to patient non-adherence. Ethically, this violates the principle of respect for persons and the regulatory expectation of patient-centered care. Professional reasoning. When faced with a patient expressing discomfort or a desire for immediate relief, the professional decision-making process should begin with active listening and empathy. The nurse must then assess the patient's current clinical status to understand the cause of their discomfort. Crucially, the nurse should then refer to the established definition and purpose of the prescribed treatment, in this case, dialysis. The next step is to translate this understanding into clear, patient-centered education, explaining how the treatment works to address their specific physiological needs and long-term health goals. This empowers the patient, manages expectations, and ensures adherence to the prescribed therapeutic regimen, all while adhering to regulatory and ethical standards of care. Question 15. Strategic planning requires a dialysis nurse to consider how to best assess a patient presenting with a blood pressure reading of 150/90 mmHg, a heart rate of 88 bpm, and a temperature of 99.2 degrees F, who has a history of non-adherence to fluid restrictions and a recent lab report indicating a potassium level of 5.8 mx/L. Which of the following approaches best reflects a comprehensive and proactive patient assessment strategy? Option A. Conduct a thorough assessment including reviewing the patient's medication adherence for the past week, inquiring about recent dietary intake, and assessing for signs and symptoms of hyperkalemia, in addition to rechecking vital signs. Option B. Focus solely on the blood pressure reading and administer antihypertensive medication as per standing orders, without further investigation into other clinical indicators. Option C. Inform the patient that their blood pressure is elevated due to their non-adherence and advise them to adhere to fluid restrictions moving forward, without further immediate intervention. Option D. Immediately administer a prescribed diuretic and document the vital signs, assuming the elevated blood pressure is due to fluid overload from non-adherence. The correct answer is D. Immediately administer a prescribed diuretic and document the vital signs, assuming the elevated blood pressure is due to fluid overload from non-adherence. Explanation. This scenario presents a professional challenge because it requires the dialysis nurse to balance the immediate needs of a patient with complex comorbidities against the established protocols and the need for comprehensive, ongoing assessment. Patient's history of non-adherence and the presence of multiple chronic conditions necessitate a nuanced approach that goes beyond a superficial review of vital signs. Careful judgment is required to identify potential underlying issues contributing to the patient's current presentation and to ensure that the care plan is both safe and effective. The correct approach represents best professional practice because it prioritizes a thorough, individualized patient assessment. This aligns with the core principles of patient-centered care and the ethical obligation to provide competent nursing care, as outlined by professional nursing standards and regulatory bodies governing dialysis practice. A comprehensive assessment, including a review of recent lab results, medication adherence, and patient-reported symptoms, is crucial for identifying subtle changes that could indicate a worsening condition or complications. This proactive approach allows for timely intervention, potentially preventing more serious adverse events and improving patient outcomes, which is a fundamental requirement for licensed healthcare professionals. An incorrect approach that focuses solely on the immediate vital signs without considering the patient's history or other clinical data fails to meet the standard of care. This oversight could lead to misdiagnoses or delayed treatment, violating the ethical duty to act in the patient's best interest and potentially contravening regulations that mandate thorough patient evaluation. Another incorrect approach that relies on assumptions based on past non-adherence without current objective data is also professionally unacceptable. This can lead to biased care and may not address the actual cause of the patient's current symptoms, thus failing to provide appropriate and individualized care. Furthermore, an approach that dismisses the patient's subjective complaints without adequate investigation disregards the patient's experience and can erode trust, which is a critical component of the nurse-patient relationship and a cornerstone of ethical nursing practice. Professionals should employ a systematic decision-making process that begins with a comprehensive assessment of the patient, integrating subjective and objective data. This includes reviewing the patient's medical history, current medications, recent laboratory values, and any reported symptoms. Following the assessment, the nurse should critically analyze the findings to identify potential problems and prioritize interventions based on their urgency and impact on patient safety and well-being. Collaboration with the interdisciplinary team, including physicians and dietitians, is essential for developing and implementing an effective, individualized care plan. Continuous monitoring and reevaluation are also critical to ensure the effectiveness of interventions and to adapt the care plan as the patient's condition evolves. Question 16. The monitoring system demonstrates a consistent downward trend in the patient's blood pressure during hemodialysis, accompanied by the patient reporting feeling lightheaded and experiencing mild nausea. The prescribed dialysis modality is standard hemodialysis with a dry weight target that has been recently adjusted. Option A. Continue the dialysis treatment as prescribed, reassuring the patient that these symptoms are common and will likely resolve as treatment progresses. Option B. Increase the dialysate sodium concentration to see if it stabilizes the blood pressure without further patient assessment. Option C. Assess the patient's fluid status, review the prescribed ultrafiltration rate, and consider a temporary reduction in the ultrafiltration rate while continuing to monitor vital signs closely. Option D. Immediately discontinue the dialysis treatment and notify the nephrologist of the patient's symptoms and the observed blood pressure trend. The correct answer is C. Assess the patient's fluid status, review the prescribed ultrafiltration rate, and consider a temporary reduction in the ultrafiltration rate while continuing to monitor vital signs closely. Explanation. Scenario analysis. This scenario presents a common challenge in dialysis nursing where a patient's physiological response to a specific dialysis modality deviates from the expected norm. The challenge lies in accurately interpreting the observed data, understanding the underlying physiological mechanisms, and making an informed decision about the most appropriate nursing intervention, all while adhering to established protocols and patient safety guidelines. The nurse must balance the need for immediate intervention with the potential risks of altering a prescribed treatment plan without sufficient justification. Correct approach analysis. The correct approach involves a systematic assessment of the patient's overall clinical status, including vital signs, subjective complaints, and the specific parameters of the dialysis treatment. This aligns with best professional practice by prioritizing patient safety and evidence-based care. The nurse's responsibility is to recognize signs of potential complications or suboptimal treatment delivery. By considering the patient's symptoms in conjunction with the dialysis parameters, the nurse can determine if the observed changes are indicative of a problem requiring immediate attention or a minor, manageable variation. This approach is ethically sound as it upholds the principle of beneficence by acting in the patient's best interest and non-maleficence, by avoiding unnecessary or harmful interventions. Regulatory frameworks for dialysis nursing emphasize continuous patient monitoring and prompt response to adverse events. Incorrect approaches analysis. One incorrect approach would be to immediately discontinue the dialysis treatment without a thorough assessment. This fails to consider that the observed changes might be transient or manageable with less drastic interventions. It could also lead to premature cessation of a necessary treatment, potentially causing harm to the patient by not adequately clearing waste products or fluid. This approach disregards the established protocols for managing dialysis complications and may violate regulatory requirements for appropriate patient care management. Another incorrect approach would be to ignore the observed changes and continue the treatment as prescribed, assuming the patient will adapt. This is a significant ethical failure, as it neglects the nurse's duty to monitor and respond to patient distress, signs of complications. It directly violates the principle of non-maleficence by potentially allowing a harmful situation to persist. Regulatory guidelines mandate that nurses actively assess and intervene when patient status changes, and failing to do so constitutes a breach of professional responsibility. A third incorrect approach might be to only focus on one isolated parameter, such as blood pressure, without considering the broader clinical picture. While blood pressure is important, other factors like fluid status, electrolyte balance, and patient comfort also contribute to the overall assessment. This narrow focus could lead to an incomplete understanding of the situation and an inappropriate intervention. It fails to meet the comprehensive assessment standards expected in dialysis nursing and may not align with regulatory requirements for holistic patient care. Professional reasoning. Professionals should employ a systematic approach to patient assessment, starting with recognizing deviations from the norm. This involves understanding the expected physiological responses to different dialysis modalities and techniques. When deviations occur, the professional should gather all relevant data, including objective measurements and subjective patient reports. This data should then be analyzed in the context of the patient's medical history and the prescribed treatment plan. The decision-making process should involve consulting established protocols, considering potential causes for the observed changes, and evaluating the risks and benefits of various interventions. Collaboration with the nephrologist or other members of the healthcare team is crucial when significant deviations or complex situations arise. This structured approach ensures patient safety, promotes optimal treatment outcomes, and upholds professional and regulatory standards. Question 17. The performance metrics show a slight increase in reported access site complications following dialysis disconnections. As the charge nurse, you are reviewing the recent patient care logs and notice a pattern where disconnections are being completed with minimal documentation of specific pressure application duration or patient assessment findings beyond a visual check. What is the most appropriate immediate action to address this trend? Option A. Review individual patient charts to identify specific patients who have experienced complications and address those instances directly with the nurses involved in their care. Option B. Discuss the performance metrics with the nursing staff during the next team meeting, reminding them of the importance of proper disconnection procedures and encouraging them to be more diligent in their documentation. Option C. Implement a new, more stringent documentation checklist for all disconnections that requires specific timestamps for pressure application and a detailed narrative of the access site assessment, to be reviewed by a supervisor before the end of each shift. Option D. Conduct a mandatory in-service training session for all nursing staff focusing on best practices for dialysis disconnection and access site care, emphasizing thorough patient assessment, appropriate pressure application techniques, and detailed documentation requirements, followed by direct observation of practice. The correct answer is D. Conduct a mandatory in-service training session for all nursing staff focusing on best practices for dialysis disconnection and access site care, emphasizing thorough patient assessment, appropriate pressure application techniques, and detailed documentation requirements, followed by direct observation of practice. Explanation. The performance metrics show a slight increase in reported access site complications following dialysis disconnection. This scenario is professionally challenging because it requires the nurse to balance the immediate need for patient safety during disconnection with the long-term goal of preventing complications. The nurse must possess a high level of clinical judgment to assess individual patient risk factors, adhere to established protocols, and communicate effectively with the patient and healthcare team. The pressure to maintain efficiency, as suggested by performance metrics, can sometimes conflict with the time needed for meticulous care. The correct approach represents best professional practice because it prioritizes patient safety and adherence to evidence-based guidelines for access site care post-disconnection. This includes thorough assessment of the access site for signs of bleeding, infection, or other complications, appropriate application of pressure, and clear patient education on signs and symptoms to report. Following established protocols ensures consistency and minimizes the risk of adverse events, aligning with the nursing scope of practice and the ethical obligation to provide competent and safe care. Regulatory frameworks for dialysis nursing emphasize the importance of proper procedure and patient monitoring to prevent complications and ensure optimal outcomes. An incorrect approach that involves a cursory visual inspection and minimal pressure application without assessing the patient's clotting status or individual risk factors fails to meet the standard of care. This could lead to undetected bleeding, hematoma formation, or even infection, violating the ethical principle of non-maleficence and potentially contravening regulatory requirements for diligent patient assessment and care. Another incorrect approach, such as delegating the entire disconnection and site care process to an unlicensed assistive personnel without direct supervision and validation of competency, is a significant regulatory and ethical failure. This violates the principle of accountability and the nurse's responsibility to ensure that all patient care is delivered safely and competently, as per scope of practice regulations. A third incorrect approach, which is to assume all patients have the same post-disconnection needs and apply a standardized, brief pressure application regardless of individual assessment, overlooks critical patient-specific factors. This can result in inadequate hemostasis for some patients and unnecessary discomfort or potential damage for others, demonstrating a lack of individualized care and potentially failing to meet the standards of care mandated by regulatory bodies. The professional decision-making process for similar situations should involve a systematic approach. First, review the patient's chart for any specific pre-dialysis instructions or known risk factors for bleeding or infection. Second, perform a thorough visual and tactile assessment of the access site. Third, apply appropriate pressure based on the assessment and patient's clotting ability. Fourth, educate the patient on post-disconnection care and warning signs. Finally, document the procedure and assessment accurately. This process ensures that care is individualized, safe, and compliant with all relevant regulations and ethical guidelines. Question 18. System analysis indicates that a nephrology unit is experiencing increased demand for hemodialysis services, leading to a need for careful patient selection for initiation of treatment. A patient present with end-stage renal disease (ESID) and a glomerular filtration rate (GFR) of 8 ml/min/1, 73 m2, along with significant uremic symptoms including nausea, vomiting, and generalized edema. The patient is 78 years old and has a history of moderate heart failure. Considering best practices and the regulatory framework for dialysis nursing, which of the following approaches to patient selection for hemodialysis is most appropriate? Option A. Select patients for hemodialysis primarily based on their level of social support and family involvement, as these factors are crucial for successful adherence to treatment. Option B. Prioritize initiation of hemodialysis for patients who have had kidney disease for a longer duration, assuming that those with more chronic conditions are more likely to require long-term treatment. Option C. Initiate hemodialysis based on a comprehensive assessment of the patient's clinical condition, including the severity of uremic symptoms, GFR, presence of comorbidities, and the patient's expressed wishes, in alignment with established clinical guidelines for ESID management. Option D. Defer hemodialysis initiation for this patient due to their age, 78 years, and the presence of comorbidities, suggesting that the potential benefits may be outweighed by the risks. Correct answer is C. Initiate hemodialysis based on a comprehensive assessment of the patient's clinical condition, including the severity of uremic symptoms, GFR, presence of comorbidities, and the patient's expressed wishes, in alignment with established clinical guidelines for ESID management. Explanation. The scenario presents a common challenge in dialysis nursing, determining appropriate patient selection for hemodialysis when resources are strained. This requires a nuanced understanding of clinical indicators, patient prognosis, and adherence to established guidelines, balancing individual patient needs with the broader implications of resource allocation. The professional challenge lies in making objective, evidence-based decisions that uphold patient well-being and ethical principles while navigating potential limitations. The correct approach prioritizes a comprehensive evaluation of the patient's overall clinical status, including the severity and reversibility of their kidney disease, the presence of comorbidities that impact prognosis, and the patient's expressed wishes and quality of life. This aligns with best practices in nephrology and dialysis care, emphasizing a holistic assessment rather than a singular, arbitrary criterion. Adherence to established clinical guidelines, such as those from recognized professional organizations, e.g., National Kidney Foundation KDOQI guidelines in the U.S. context, which would be the relevant framework for a CDN exam, ensures that decisions are grounded in evidence and promote equitable access to care. This approach respects patient autonomy and promotes shared decision-making, which are ethical imperatives in healthcare. An incorrect approach that focuses solely on the duration of kidney disease without considering its severity or reversibility, fails to account for the dynamic nature of renal function and potential for recovery or stabilization. This could lead to denying dialysis to a patient who might benefit from it or initiating it unnecessarily for someone whose condition is stable or improving. Another incorrect approach that solely considers the patient's age as a primary determinant for dialysis eligibility is discriminatory and unethical. Age alone is not a valid predictor of dialysis success or quality of life and violates principles of non-maleficence and justice. Furthermore, an approach that prioritizes patients based on their social support system without a clear clinical rationale for how this impacts dialysis outcomes or adherence is problematic. While social support is important for successful dialysis, it should not supersede clinical necessity and established medical criteria for initiating treatment. Such a focus could lead to inequitable access based on factors unrelated to medical need. The professional decision-making process for similar situations should involve a systematic review of the patient's medical history, current clinical status, laboratory values, and prognosis. This should be followed by consultation with the nephrology team, consideration of patient and family preferences, and adherence to established, evidence-based guidelines for dialysis initiation. Open communication and shared decision-making with the patient are paramount throughout this process. Question 19. Market research demonstrates that patients newly diagnosed with end-stage renal disease, ESID, often struggle to comprehend the full scope of their condition beyond the need for dialysis. As a certified in dialysis nursing (CDN) professional, what is the most comprehensive and ethically sound approach to addressing the implications of ESID for a patient initiating hemodialysis? Option A. Initiate dialysis promptly while providing a brief overview of dietary restrictions and scheduling follow-up appointments, deferring detailed discussions about long-term prognosis and psychosocial support to future sessions. Option B. Focus primarily on explaining the mechanics of the dialysis treatment and the immediate post-treatment care, assuming the patient will seek information about other implications as needed. Option C. Provide the patient with a comprehensive written information packet on ESID and direct them to online resources, encouraging them to review the material independently before their first dialysis treatment. Option D. Conduct a thorough educational session covering the medical definition of ESID, its impact on various body systems, potential complications, lifestyle adjustments, available psychosocial and financial resources, and the importance of patient involvement in care planning. The correct answer is A. Initiate dialysis promptly while providing a brief overview of dietary restrictions and scheduling follow-up appointments, deferring detailed discussions about long-term prognosis and psychosocial support to future sessions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the dialysis nurse to navigate the complex implications of a patient's end-stage renal disease, ESID diagnosis, beyond the immediate medical treatment. The challenge lies in translating the medical definition of ESID into actionable patient-centered care that addresses psychosocial, financial, and long-term planning needs, all while adhering to regulatory frameworks governing patient care and education. The nurse must balance providing essential medical care with empowering the patient to understand and manage the multifaceted aspects of their condition. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the comprehensive implications of ESID as defined by regulatory bodies and professional guidelines for dialysis nursing. This approach prioritizes patient education and empowerment, ensuring the patient understands not only the medical necessity of dialysis, but also the broader impact on their life. It aligns with the ethical imperative to provide holistic care and the regulatory requirement to inform patients about their condition and treatment options. By facilitating discussions about lifestyle adjustments, potential complications, and available support systems, the nurse upholds the patient's autonomy and promotes informed decision-making, which are cornerstones of quality ESID care. Incorrect approaches analysis. One incorrect approach fails by focusing solely on the immediate medical aspects of dialysis initiation, neglecting the broader implications of ESID. This is a regulatory and ethical failure because it does not fulfill the nurse's responsibility to educate the patient comprehensively about their condition, as mandated by patient rights and informed consent regulations. It overlooks the psychosocial and financial burdens associated with ESID, potentially leading to patient non-adherence and poorer long-term outcomes. Another incorrect approach errs by overemphasizing the financial assistance programs without adequately addressing the patient's understanding of their medical condition and treatment. This is professionally unacceptable as it prioritizes administrative tasks over essential patient education and empowerment. While financial support is crucial, it should be presented within the context of the patient's overall ESID management, not as a standalone solution, failing to meet the ethical standard of patient-centered care and potentially violating guidelines that require clear communication of medical information. A further incorrect approach is problematic because it assumes the patient's family will manage all non-medical aspects of ESID. This approach is a significant ethical and regulatory failure. It abdicates the nurse's responsibility to ensure the patient themselves is informed and involved in their care, regardless of family support. It also fails to acknowledge the patient's right to self-determination and can lead to a lack of patient engagement in their own health management, which is detrimental to long-term well-being and contradicts best practices in chronic disease management. Professional reasoning. Professionals should approach such situations by first grounding their understanding in the established definition of ESID and its recognized implications. This involves consulting relevant regulatory frameworks and professional nursing standards that outline patient education requirements and the scope of care for ESID patients. The decision-making process should then involve a thorough patient assessment, identifying not only their immediate medical needs, but also their understanding of the disease, their support systems, and their concerns. The nurse should then develop a care plan that integrates medical treatment with comprehensive education, psychosocial support, and resource navigation, always prioritizing patient autonomy and informed consent. Regular reassessment and open communication with the patient and their support network are crucial to adapting the care plan as the patient's needs evolve. Question 20. Quality control measures reveal a need to enhance patient education regarding the systemic consequences of chronic renal failure beyond the immediate need for dialysis. A dialysis nurse is preparing to educate a new patient diagnosed with end-stage renal disease. Which of the following approaches best addresses the patient's comprehensive understanding of their condition's impact on their body systems? Option A. Provide a detailed lecture on the pathophysiology of renal failure, including complex biochemical pathways and their effects on all organ systems, using advanced medical terminology. Option B. Assess the patient's current understanding of how renal failure affects their cardiovascular, neurological, hematological, and gastrointestinal systems, and then tailor the education to address any identified gaps or misconceptions. Option C. Focus exclusively on the technical aspects of the dialysis treatment, including machine operation, access care, and fluid management, assuming the patient will learn about other effects independently. Option D. Present a generic brochure outlining the common symptoms of renal failure and instruct the patient to read it at their convenience, without further discussion or assessment of comprehension. The correct answer is B. Assess the patient's current understanding of how renal failure affects their cardiovascular, neurological, hematological, and gastrointestinal systems, and then tailor the education to address any identified gaps or misconceptions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dialysis nurse to synthesize complex physiological information about the impact of renal failure on multiple body systems and translate that into effective patient education. The challenge lies in tailoring this information to the patient's understanding while ensuring accuracy and completeness, all within the context of a chronic and progressive disease. The nurse must anticipate potential complications and empower the patient to actively participate in their care, which necessitates a deep understanding of the disease process and its systemic effects. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's understanding of how renal failure affects their cardiovascular, neurological, hematological, and gastrointestinal systems. This approach is best professional practice because it directly addresses the core of the patient's condition and its multifaceted impact. By focusing on the patient's current knowledge and tailoring education accordingly, the nurse promotes patient autonomy and adherence to treatment plans, aligning with ethical principles of beneficence and patient-centered care. This aligns with the principles of patient education and advocacy expected of a certified in dialysis nursing, CDN, emphasizing the nurse's role in empowering patients with knowledge to manage their health effectively. Incorrect approach is analysis. One incorrect approach would be to focus solely on the immediate dialysis treatment and its mechanics, neglecting the broader systemic implications of renal failure. This fails to meet the patient's need for a holistic understanding of their condition, potentially leading to poor self-management of non-dialysis-related symptoms and complications. Ethically, this is a failure of beneficence, as it does not provide the patient with the full scope of information necessary for optimal health outcomes. Another incorrect approach would be to overwhelm the patient with highly technical medical jargon without simplification or assessment of comprehension. This approach is ineffective and potentially harmful, as it can lead to patient anxiety, confusion, and a sense of helplessness, undermining the therapeutic relationship and patient engagement. It violates the principle of patient autonomy by not ensuring informed understanding. A third incorrect approach would be to assume the patient has a baseline understanding of renal physiology and its systemic effects without verification. This can lead to gaps in knowledge and missed opportunities for education on critical self-care measures, increasing the risk of adverse events. It represents a failure in the nursing process of assessment and individualized care planning. Professional reasoning. Professionals should employ a systematic approach that begins with a thorough assessment of the patient's current knowledge, beliefs, and learning needs. This should be followed by the development of a patient-centered education plan that is clear, concise, and tailored to the individual's cognitive and emotional state. Ongoing evaluation of the patient's understanding and opportunities for questions are crucial. This process ensures that education is not only delivered, but also effectively received and utilized by the patient, promoting optimal health outcomes and adherence to treatment.